Joining us now is Dr. Miriam Lalas from the Philippine College of Chest Physicians. Doc, good evening and welcome to The Final Word.
Hi, good evening, Ms. Menchu, and to all our viewers.
Well, Doc, you heard Paige Javier's report. No, the public should not underestimate the effects of the smog on their health. But what are really some possible complications and long-term effects of this?
Yeah. Okay. So that is true. No, that we really need to we really need to be wary of this air pollution, of the air quality in our place, because in the short term, no, it depends really on the risk factor of patients. So there are actually several factors that would determine whether we will experience health effects from air pollution. So one would be the concentration of the air pollutant and the type of air pollutant, and how long are we exposed to that air pollution. And also we need to take into account if we have pre-existing conditions that would predispose us to experiencing health effects of air pollution. So maybe the minor effects that I'll start to talk about would be, for example, in the eyes, we can experience eye irritation. So we can experience redness or itchiness of the eyes. The skin, as what was mentioned earlier, we can experience some itchiness and also redness of the skin. But most importantly, for the lungs, and actually the heart as well, and the rest of the body, because these air pollutants, when they enter the body, they can cause minor effects like cough, throat irritation, sneezing, and runny nose. But for those who have conditions like asthma, COPD, for those who have heart conditions, they may experience worse health effects from this, which can lead to hospitalizations and emergency room consults.
Okay, well, the DENR says no that air quality in Pateros is very unhealthy. In Makati, it's acutely unhealthy, and in Parañaque, it's unhealthy for sensitive groups. What do those mean exactly for residents in those areas?
Okay, so the what is being reported now by the NR, that would be the air quality index for particulate pollution. So there are corresponding health advisories per level of that category in that air quality index. So basically, it's like a rough guide on how we can give our health advice to our population. So like you mentioned, there would be those that would mean the acutely unhealthy or unhealthy for sensitive groups. So as you can see, based depending on how high the level of air pollution is, the worst health effects we expect from them. But we can also see from that air pollution index that those who belong to the sensitive groups, like what I mentioned, asthma, those with COPD, are the ones who are more likely to experience the health effects more than the rest of the population.
So what should local governments do to minimize the harmful effects on their residents?
Okay, so in terms of what local governments can do, we've seen giving away of face masks, so that's good for the people, but also to mitigate the sources of air pollution, especially in this case here in Metro Manila. So right now, what I can think of is that, for example, there are some cities who have like anti-idling ordinances. So that's good that if they can implement that, and if more cities can actually adopt that, because it will lessen the level of air pollutants in the atmosphere. And also strict implementation of like anti-smoke belching laws, so that we are not adding air pollutants into the air.
And
so those are just some of the things that local governments can do.
All right. Well, some of the tips that people give is stay indoors, wear the N95 masks, but obviously people can't stay indoors forever, and the N95 masks are expensive, let's face it. What else can the public do to avoid the health risks of smog?
Okay. So yes, like you mentioned, one is stay indoors and two is the mask. It's really the N95 that is most ideal to be used in this situation. But understandably, we may not always have access to that because it's quite expensive.
Yes.
But at least wear a surgical mask, probably that is tight fitting, to ensure that less of the air pollutants are going through the mask, especially on the sides of the face. And also there would be instances that patients really would not, some people would really not have access to any form of mask, but like a cloth that that is slightly moist can also help in filtering out some of the large particles. But of course, these are not guaranteed to protect against the smaller particles. But still, that's better than nothing at all.
All right. And how about people with asthma and other respiratory conditions? How can they take care of their health in these situations and also protect our children and babies who might be too young for masks?
Okay, so for those who belong to the sensitive groups, like the asthma patients, well, they really need to take their medications. I mean, if they are maintained on like some sort of inhaler, then they really have to take it religiously, because now is not the time to be missing out on these medicines, because then you will be more susceptible to having flare up of your asthma condition. And also to communicate very well with your doctor, so that any time that you experience a worsening of symptoms that is no longer relieved by the usual inhalers or the usual medications, then you proceed to the to the nearest hospital in your place to have yourself checked. And at the same time, let's follow the same precautions like wearing of mask and staying indoors as much as possible. Now, for the babies, for the kids, well, kids normally want to play outside, but especially in conditions where the air quality is so poor, we wouldn't want them to be going out and playing outdoors, because as they exert more, they're going to breathe in more and more of that particles, of that pollution. So we don't want that. We really want to keep them indoors as much as possible.
All right. And as for Taal Volcano, PHIVOLCS really can't predict when the VOG will end. Very quickly, what should residents near the volcano do? Is there something special in that circumstance?
Okay, so in highly boggy areas, actually the first protection is really to move away from the source of the VOG, because VOG is composed primarily of gas. So it's going to be the masks are going to be less effective. VOG still contains some of the particulate pollution that masks protect against, but the protection could be limited. So really, we need to follow the advice of the local governments there in terms of how far away to evacuate. And also, again, stay indoors, and then pretty much the same precautions as what we have here in Metro Manila for the smog.
All right. Thank you for joining us and for your advice, Dr. Miriam Lalas from the Philippine College of Chest Physicians.